Snoring is common, all right, maybe you do it, perhaps you know or live with someone who snores, and if the advertisements are believed, all you need to do to cure that habit is to use a special mouth guard or wear a nasal strip or perhaps have surgery. Joining us today for some straight talk on snoring is Dr. Eric Kazarian, the director of the sleep surgery at the University of California, San Francisco. Dr. Kazarian, thank you so much for talking today. I need to talk about this. Why do people snore? Let's start with the facts.
Well, people snore for a wide range of reasons. Snoring is basically this unintentional sound that's produced by vibration of structures in your throat. Typically the back of the roof of your mouth or the soft palate, and then the uvula that hangs down in the back of your throat. There's a wide range of reasons. I mean, it can involve the nose or various regions of the throat. And it's really that, I think what we've learned more and more is that people snore for different reasons. And so choosing among this wide range of treatment options, whether we're talking about things like these special mouth guards, various sprays for the nose like salt water or medications, even those strips over the nose, and a whole range of various procedures that are available, no single treatment probably works for everybody all the time.
What treatments do work? What are the over-the-counter things that do work for folks?
Well, different treatments work very well for different people, and there's a great saying when it comes to snoring that snoring's in the ear of the beholder. Oh. And so some people that are within earshot of people who are sleeping through no fault of their own are just lighter sleepers. Right. So that a given amount of snoring sound can be very disruptive and interfere with their own sleep. And then the next step beyond that, in terms of thinking about various treatment options, I think because people do snore for different reasons, the key part of patient evaluation is figuring out what factors may be playing the most important roles for different people.
What role does alcohol play in snoring?
So alcohol probably increases everybody's snoring. And a lot of people don't snore without alcohol, but will snore if they've had alcohol within 3 or 4 hours before going to bed. Basically, it relaxes the muscles around your throat, and it basically lets everything be more collapsible and more likely to flutter around and produce that snoring sound during sleep.
Is snoring bad for our health in any way? I mean, can it kill you?
Well, there's some evidence to say that snoring by itself can lead to the development of things like high blood pressure, but in general, we think that snoring by itself is more of a social problem, more of a nuisance. Snoring, unfortunately, can also be a sign of a more serious problem called obstructive sleep apnea, which includes not only snoring, but also blockage of breathing passages during sleep. That does have notable effects in terms of health impacts on the cardiovascular system, things like high blood pressure, stroke risk, heart attack risk, or even early death. And then sleep apnea can have more important effects on daytime sleepiness. Basically, people who are repeatedly having blockage of the breathing during sleep often wake themselves up, robbing themselves of the deeper, more restful stages of sleep.
Okay, so what can people do to quiet the snoring without getting over-the-counter strips or something, sleeping on side, losing weight? Are there any personal things that we can do?
Well, I think in general for everybody, probably avoiding alcohol within those 3 or 4 hours before going to bed can be very helpful. Right. In addition, sleeping on your back is typically the most provocative position for snoring and sleep apnea, so sleeping on your side or your stomach can be very helpful. Of course, weight loss is probably the #1 risk factor for sleep apnea and snoring, so weight loss can be very beneficial. In terms of moving beyond that and choosing among various treatment options, really some things can be very helpful for certain patients. For example, if you only snore or have problems in blockage of breathing when your nose is really blocked up, focusing on the nose and getting the nose more open from a various range of various possibilities can be very helpful.
Okay, let's talk about singing real quick. I don't know if that's an old wives' tale or what, but they say singing helps with the snoring. Also, something in Australia, that there's a musical instrument called the didgeridoo. And I know you've heard of this because you were just in Australia. What is that, and does it work, and does it help? Let's talk about that.
So there hasn't been all that much research done related to singing or the didgeridoo. There's one study for the didgeridoo took a very selected group of patients with sleep apnea. Basically, they were thin, they had relatively mild to moderate sleep apnea, and it seemed to provide some benefit. What both singing and playing this instrument seem to do is they increase the muscle tone, so they make the muscles stronger and less likely to be collapse around the throat and produce sleep apnea. So they can be very helpful for the right kind of patients, but I think we're far from saying that they're treatment for everyone.
All right, so the best bet, probably avoid that alcohol and get some second opinions from your doctor if it's that severe. All right, thank you, Dr. Kazarian, talking about snoring.
When you think health, think IRU.